Okay, I think we are good to go now. I'm not sure what happened, but we can troubleshoot it another time. Should be good. And yeah, good. Thanks, Amanda. I saw you posted the agenda. So thanks for waiting a little bit, Amanda. And Debbie, thanks for your patience.
Awesome. Thanks so much, Lindsay. Lindsay. Go team. Hooray. We are streaming live on the YouTube. So good morning, everybody. For folks who might be listening or who don't know me, I'm Amanda Peterson. I'm the Director of Early Childhood at KSDE, at the Kansas State Department of Education, and I am the chair of the Kansas Early Childhood Recommendations Panel. And so Debbie is the Early Childhood Systems Coordinator at the Children's Cabinet and Trust Fund. We are so excited about today's meeting. It really gives us a chance, as we were thinking about what we wanted to accomplish with the panel, we really want all of you to be able to provide input and help shape the way that we move our work forward. And we want to be able to have this be a place where we can bring together different pieces of work, help people be aware of the resources and the tools and the initiatives that are underway, and really empower people around the state to be able to take these resources and incorporate them into all of your work. And so we're thrilled about today, and we're really looking forward to and appreciative of the presentations that we are going to hear and the discussion that we are going to have. So with that, welcome. Thanks for all of you for joining us. As a reminder, this is a remote meeting, and since this is a public meeting, that means just a couple of things. Due to the pandemic, we're meeting by Zoom, and the YouTube video live stream of this meeting can be reached by visiting the Kansas Children's Cabinet and Trust Fund website. All participants, please, we're all pros at this by now, make sure that your microphones, phones, other electronic devices are muted when participants are not speaking so that we can all hear. The chat function we've used so far for folks on YouTube to post the link to the agenda, but we're not going to be using it to have conversation or make decisions, since that's not something that members of the public can see. If there are any motions, they'll be clearly stated, and I will ask for a show of hands and then clearly announce the results. And we'll all try to make sure to remember, even though it's a little bit awkward, to introduce ourselves with our name when we start talking, so that folks who are listening know who we are. With that, we've also got the raise hand feature, which is super helpful for me and Debbie, because it helps us flag when you've got something to say, since we do have a large group who are serving here on this panel. So our first order of business today is to approve the draft agenda that was sent out by Debbie last week, and there's also a direct link to that in the chat bar. It's posted on the Children's Cabinet and Trust Fund website. If you're ever looking for information related to the panel, if you're looking for the slides for today, visiting the Children's Cabinet and Trust Fund website, going to About, and then going over to Panel and clicking on Meetings is where you can find all of that information. So I hope that everybody, here's the proposed agenda. We'll be sharing follow-up from last meeting. We'll have a Kansans open forum. We will discuss the pre-meeting survey results that Debbie spearheaded to get some baseline information about the topics we're discussing today. And then we'll have presentations and discussion on 2 items, the Kansas Power the Positive Initiative and 1-800-CHILDREN. We'll have a brief 5-minute break in between, because we know that it's a Friday and we want to make sure that everybody has time to move around and stretch. And then, as always, we will have requests for any future agenda items and discuss upcoming meetings. Do I have a motion to approve the proposed agenda?
This is Natalie McLean. I would make a motion to approve today's agenda.
Thank you, Natalie. And Eva, I see that you are off mute.
Yeah, I'll be happy to do the second.
Thank you, Eva Horn, for seconding. If you all could raise your hands or do a thumbs up emoji on the Zoom to approve. Fantastic. Anybody who would like to disapprove, please come off mute and say so. Fantastic. Thanks, everybody. Our next order of business is to approve the October 16th meeting minutes. This was the meeting where we focused on the kindergarten transitions MOU and that document. And I hope that everybody got a chance to read through those minutes. Do we have any proposed revisions or edits to the minutes? Hearing none, would anybody like to make a motion to approve the October 16th draft minutes?
This is Amy Meek, and I make a motion to approve the minutes.
Thank you, Amy.
This is Cornelia Stevens. I second.
Fantastic. Thanks, Cornelia. Same drill. If you could raise your hand or do a thumbs up emoji to approve. I am scrolling. Fantastic. If you would like to disapprove, please come off mute and say so. All right, go team. We have approved the minutes. And there we go. We had a slide for that too. But we had it covered because we clearly identified ourselves when making the motion. So go team. Good job, everybody. So I will turn it over to Debbie to talk through some of the follow-up items from our last meeting.
Thank you, Amanda. And when Amanda was mentioning just a minute ago about how important this panel work is and moving the work forward and everybody getting engaged, I think we had a fantastic meeting in October. And for any of you though that were with us, it was such a productive meeting. And so back in July, the recommendations panel tasked a work group to begin developing resources to support successful transitions from early learning to kindergarten. Because going back to the needs assessment that was done, there were many Kansas families that expressed an interest in needing for this to improve, that there were some disconnects with this smooth transitioning, and that they just a lot of times didn't understand, how to even go about it. And so this work group was put into place by the panel, and several panel members volunteered to serve on it, and they only met just a few times. And during that time, they were able to develop a memorandum of understanding toolkit for communities to use and adapt as needed in order to collaborate within their communities and help these transitions become smoother. And this would be an agreement between all partners involved in the memorandum. And this also goes back to address many of the strategies and tactics that are listed in the All In for Kansas Kids strategic plan. So at the October meeting, this was presented, it was discussed, and it was very successful. There were also a lot of discussion on the dissemination plan that might happen once this MOU is completed. And so the plan now is for this to be taken in front of the Children's Cabinet on December 4th. So the recommendations panel was successful in making their first formal recommendation, and this will go in front of the Cabinet at the December 4th meeting. And they will be able to hear what it's about, to ask questions, and then possibly decide to accept it. And if that happens, then it will also next be taken on that afternoon to the Early Childhood Stakeholders Group meeting. And we will have further discussion there of more ideas on how to successfully disseminate this plan. And based on all of that, then I will compile the ideas from the panel on dissemination and the Early Childhood Stakeholders Group and design a dissemination plan that will broadly be distributed throughout the state of Kansas to be used in all of our communities. And also, as soon as that all of those final documents are in place and approved, then those will also be put on the Children's Cabinet website. But very successful meeting. A lot of hard work was accomplished, and kudos to the work group. And I know that our meeting today is going to be just as meaningful and productive. Thank you.
Thank you, Debbie. It is really exciting to see the vision that we had for this group be put into practice and be able to see some of our governance and early childhood pieces. I mean, we want to have a system where we're able to do meaningful work and move the work forward. So it's exciting to have this first recommendation and be thinking through, gosh, how do our different groups interact, and how are we able to mobilize and come together so that we can really move the work forward in a meaningful way. Does anybody have any questions for Debbie? Any follow-up items from previous meetings? All right. The next item on our agenda is the Kansans Open Forum. And this is our chance for, we know that public participation is a key value that we have as we're thinking about our early childhood system. We want this to be something that is really participatory, where people have the opportunity to share their ideas and perspectives and feedback and expertise to really help move the work forward. And I'm really glad that today we have had a group that has reached out to share comments with all of you. This builds on work that we have previously discussed with the panel. And so as a reminder, we've got some time for the presentation. It will be brief, and then we will have a chance for any follow-up or clarifying questions from members of the panel. So this will be information that we'll then incorporate into the meeting minutes and send out as follow-up for this meeting, so that we have it to incorporate into our work. So with that, I will turn it over to Beth Toland to share her comments.
Good morning, Ms. Peterson and the entire recommendations panel. Thank you for allowing me this opportunity to speak with you all today. I am Beth Toland. I am the Early Childhood Education Specialist for Allen Community College. Kansas is fortunate enough to have 11 community colleges currently offering early childhood education programs. The Early Childhood Quality Instruction Partners, referred to as EQIP, is the collaborative group bringing together the program leads and related early childhood state agencies, some of which you all participate. As the coordinator for the group this year, I am reaching out with our collective support of the state's adoption and implementation of a workforce registry for childcare and preschool teachers and KDHE licensed programs.
Do you have your
college
plans?
Program leads, we work closely with individuals, both wanting to join, currently working in
with the guy you're meeting.
Workforce.
Hey, Melissa. Sorry, Beth.
Hold
Melissa.
on just a second. I gotta answer a question.
There we go. Sorry, go ahead, Beth.
That's okay. We know that high quality early childhood education is the best economic development investment that we in Kansas can make. And we believe the best way to improve the quality of early experiences is to invest in the education and training of early childhood providers. A workforce registry can integrate national professional development standards supporting all providers to establish a professional development plan and intentionally choose a career pathway. We can support teachers across the state to increase the quality of early experiences for all Kansas children. A workforce registry should centralize access to not only community-based trainings, but help providers connect to higher education opportunities that best meet the career goals and goals for increased quality care and education. And we know that the labor data that Child Care Aware Kansas has provided from us in their reporting, that we have a fundamental problem with the education of our child care workforce, where people come in with some community college training, but the majority of our providers do not have at least an associate's degree. Additionally, a workforce registry could highlight the qualifications of trainers and educators, which will further support high quality training and education for the entire workforce. Based on research from the National Association for the Education of Young Children, we know that high quality experiences are dependent on a workforce that has access to high quality professional development, general and early childhood higher education coursework, and technical assistance. A workforce registry would have the potential to provide equal access across the state to information, opportunities, and career development in each of these areas, improving on our current practices as a state. It is time for Kansas to join the other 41 states who have already adopted early childhood registries and create a tool that drives the increased quality of early childhood experiences for all young children and families in Kansas by better supporting the early childhood workforce. And I respectfully submit our information and our perspective. And this is from Allen Community College, Barton Community College, Butler Community College, Cloud Community College, Cali, Dodge City, Garden City, Highland, Hutchinson, Johnson County, and Labette.
Fantastic. Thank you, Beth. Thank you to the entire EQIP group that was able to pull together and share those comments with us. We appreciate that it takes time and effort to coordinate any collaborative group, and that pulling together and getting information forward and really being able to put out a position on an issue is something that can take a little bit of work, so we appreciate it. Do we have any clarifying questions from members of the panel for Beth?
No clarifying question, just a thank you for your work on this. For all the community colleges who are working on this, it's so critical for our early childhood workforce, and appreciate the work that you all are doing.
Thank you, Gail. All right, well, Beth, thank you. This is certainly an issue that we know we are going to continue to be working on as a state. There is work underway to continue moving this project forward, and so we really appreciate that we've got this comment and support to help bolster that effort. There's a lot of ways to stay up to date on the Early Childhood Workforce Registry, but for folks, and thank you, Eva Horn, for noting additional thanks in the chat bar. But we know that for everybody who's listening, if you're interested in learning more about what an early childhood workforce registry is, I'd highly encourage you to take a look at some of the previous All In for Kansas Kids webinars that are posted on the Children's Cabinet and Trust Fund website. There's some great primers on there to help talk through exactly what this system is and what it will mean for our state. And then signing up for those weekly email updates, which you can do on the Children's Cabinet and Trust Fund website, is a great way to make sure that we feel very confident that we'll be sharing the word far and wide as there are opportunities to get engaged in this work, when there are eventually opportunities to join the registry. But if you want to make sure that you're not missing anything along the way, those All In for Kansas Kids weekly email updates are a fantastic way to do it. So Beth, I'm sure that we will continue to be in touch and to be working on this issue as we move forward, and we appreciate your comments today.
Thank you very much.
All right, I will now turn it over to Debbie as we move to our next item on our agenda, which is talking through the pre-meeting survey that many of you completed.
Amanda, did you get my message about our live stream may or may not be working? I just wanted to pause maybe for a second and make sure that that's okay.
Let me do a quick, very high tech. I'll take a look at YouTube on my phone.
I think it's okay.
Is it okay?
Did someone message you saying it wasn't?
Yeah, someone said they had gotten a message from saying that it might not be working. So I just wanted to double check.
Okay. Well, we'll check on it and keep an eye on it.
Okay, thank you, Lindsay. Okay, moving forward with the survey, and I have to apologize in advance that I discovered this morning that maybe not all of the panel members received this. I had some email issues, so I apologize for that if it was the case. So I will report the results that we did receive, and out of who I think I sent it to, we got about a 65% participation. But this survey was sent out in advance because we just really wanted to get a feeling of how many of you are familiar with the programs that we're going to be discussing today, Kansas Power of the Positive and 1-800-CHILDREN. And also just having these results maybe shape and drive the discussions that we do have. So I'm going to briefly go through them just because I want us to have plenty of time to do the rest of our meeting today. So you can see here from this slide that it's about even as far as who is familiar and not familiar. So I think that it will be useful to learn a lot about what Kansas Power of the Positive does and how the panel can get engaged in that. Do you currently use the Kansas Power of the Positive's resources? And so this was no. Several of you saying no. So again, the information that they share with us will be able to allow us to disseminate their work throughout the state, I hope. So we had listed some community organizations that you currently use in your work. And so there are several of you that are out there. It's inspiring to see that many of you are already doing some of these things. We did have one comment in the other, which was that the Kansas Department of Education shares resources for early childhood champions, school districts, etc., to then share with these audiences. So that's another way that this work is getting done. This was alarmingly no. And so I think that this is a great opportunity for the panel to learn about this work and to decide how they can best go back out and share it with their community leaders and start making early childhood be a part of their conversations. Because I think something that keeps coming up over and over again recently is that this pandemic has brought to light even more the importance of early childhood in our communities, the essential services and the essential workers that it provides. And so I think all early childhood stakeholders can play a pivotal role in getting this information out and elevating the profession. Moving on to 1-800-CHILDREN, there are several of you that are somewhat or familiar with 1-800-CHILDREN. And so again, that is going to be helpful today as we learn even more about what they do and how we can get involved. Do you currently utilize this? Yes, a good number says yes, so that's a good number to start with. And then there's always room for improvement, so we'll be able to see that happening moving forward. So many of you said no, that you don't have this 1-800-CHILDREN hyperlink or search bar currently on your websites. And so today we're going to get the opportunity to have a how-to guide, if you will, on how to do that and be able to incorporate that into what you do and share it out with that for them. And there was one more question on, do you have any success stories to share? I did get somebody respond that yes, they had one. I did not receive anything via email, but I just want to encourage all of you to do that as you maybe move through this work and learn more about it and share that with us so I can pass that forward at some point in time. So thank you everyone for responding to the survey.
Fantastic. Thank you, Debbie. Yeah, so obviously when we were envisioning the panel, we did not really contemplate that we might go an entire first year with a fully virtual format. And so we've really been trying to think about ways where we can provide lots of different opportunities for panel members to share way to do that prior to the meeting or with polls. But I do really want to encourage everybody, as you have feedback or ideas or questions or comments, please don't hesitate in between meetings to reach out to Debbie and to myself to be able to share that feedback so that we can think about ways that we can incorporate that into these meetings. Because I know that when we've got about 40 people on the Zoom, it can be a little challenging to make sure that everybody has a chance to jump in verbally to share their comments. So thank you for being able to respond to these surveys so that we can help get some of that baseline beforehand and be able to make great use of our time when we're here together. I'm now really thrilled to turn this over to Vicki Roper and Rochelle Soden with the Kansas Children's Service League. They're going to present an overview of the Kansas Power the Positive initiative. And this really is a reminder back in back in August, we had a conversation as a panel about the Good Beginnings Last a Lifetime campaign that the Kansas Department of Health and Environment is looking at is working to reinvigorate to help elevate the early childhood profession in the state, specifically childcare. And we had a great conversation as a panel about opportunities to outreach to local chambers of commerce and local businesses. And so we are thrilled that we have Vicki Roper and Rochelle Soden here with us today to talk through some of the resources that are available and the work underway to do just that. So Vicki and Rochelle, I will turn it over to you.
Thank you, Amanda. It's great to be here. Thanks for inviting us. This has really been highlight of my career doing this project with the Centers for Disease Control. So I'm thrilled to be able to share it with you. We've got about 5 to 10 people on this call that are a major part of this coalition. So feel free to help me with this, put things in the chat, raise your hand, interact, and be a part of the conversation here. Essentially, just in a thumbnail sketch, right now, this project began in 2014. The Centers for Disease Control was trying to figure out ways to prevent and mitigate adverse childhood experiences. And they discovered that 70% of the impact of adverse childhood experiences really is in the workplace. And so that has been their first target. Their frame is safe, stable, nurturing relationships and environments is where we're going with this and what we're trying to create. And the first place we're looking to do that is in the workplace. So in the workplace, that's family-friendly workplaces. We've designed a couple of things to work in the workplace. We've had about 40 agencies involved up to this point. Kansas was selected in the first 5-year project. We didn't receive CDC funding because our state didn't allow us to press send. And it's, sort of a fun story, but it didn't seem so fun at the time. But kind of what happened there is I was flying to the CDC 2 weeks after we couldn't press send and asked if Kansas could be involved anyway in this project. And they sent it up to the highest ranks and word came back, yes. And it's the first time that states who haven't received the funding can participate, and money was set aside for them to participate in a CDC project like this. So probably 20 states have participated in various ways, and Kansas took on, we asked if we could participate at the same level as the funded states. If we raised private funding, and our private health foundations came through in a big way and allowed us to do that with private funding in the first 5 years. And then for the second 5 years, which we're a part of now, we applied and we got funded. So we're in a different role with the CDC now as a funded partner. We're one of 7 states that's funded and are learning so very much. So one of the things that we're doing that we're going to be sharing with you today is our public engagement and education campaign that has been created over the last 7 years to take into the workplace. And at this point, I think we're between 3,000, 3,500 people have been trained in this public engagement campaign. And it leads us to making connections between community members and local businesses, which is what brings us here today to meet with you. We're getting this out to chambers of commerce, to economic development groups, to major businesses in the community, to employers. This is really broadened to employers now, and of which you all are mostly a part of an employee group for an employer. So we're trying to connect employers to a survey that's been developed by this coalition, and it's been piloted, and now it's had its first review for real, went live, and we're trying to get more and more employers and employees to take this survey. So we'll be explaining that a little bit later on. So those are kind of the 2 areas we're going to talk about today, are the public engagement and the education campaign and the business survey. So next. And we're looking at you all as being able to take this out should you so choose. So we're looking at, providing a train the trainer in early 2021, where we would, be able to get the toolkit out to you all that's been developed and do a training and, make this all happen so that people have a comfort level with doing this in their communities. We've started to create an infrastructure system with Train the Trainers. We currently have 54 folks that have been trained in this as trainers. And to just give you a little bit of how this has extended our reach, we trained a little over 2,000, I think 2018 or something in last year, in calendar year, well, actually in federal year 2020, and 960 of those were trained by the people that were trained in the train the trainer. So it, definitely extended the reach of the project. And we're just anticipating that that'll just grow over time as people develop a comfort level with, working with business and employers in their communities. One of the things that I know, just being in Wichita, and you Wichita people will know this, is for 2 decades, we've tried to really work hard to connect business with early childhood, and we've done okay, but we've really failed in a lot of respects. And this presentation has been great at being able to engage businesses in our communities and all get on the very same page. One of the things for you all to know as we're starting into this is the U.S. Chamber of Commerce Foundation has come out with 2, I call them white papers, about how early childhood can connect with employers and with business in their communities. The messaging, the language, they've done a lot of work on this, and we'll cover a lot of that in the Train the Trainer. But it's important to know that this is a priority of the U.S. Chamber of Commerce Foundation to look at family-friendly workplaces, to look at childcare, which is kind of the heavy lift of this family-friendly workplace piece, to implement in communities. So you've got the full support of the U.S. Chamber of Commerce as you're going in and working in your communities. So the title of this is Boost Your Competitive Edge. It's Actions for a Healthy and Productive Workforce. And that is a Center for Disease Control title. They've spent a lot of time on this, and there's a lot of research that's going into this. You'll see their research on every slide. We're doing this with the Kansas Department of Health and Environment, Department of Injury Prevention, and actually the entire Kansas Department of Health and Environment's on board with this. Our leadership team is comprised of all 3 bureau chiefs and representation from all 3 bureaus. You'll see more and more that that public health is realizing the importance of linking with business, the importance of linking with employers, and there's more and more coming out all the time around this. Next. All right, this is a little antiquated. This came out in February of 2020 when we had a 3.4% unemployment rate in Kansas and 50,000 open jobs. And I was going out and, doing this with all of our Train the Trainers and talking to people in our communities, and everybody got this, that we had so many open jobs and the lowest unemployment rate in decades that we were needing to move Kansans, unemployed Kansas, into the workplace. And since then, we're at about a 5.9% unemployment rate today, but that's come down drastically from earlier in the year under COVID. And a lot of people, Commerce is working really hard too on all of this and, kind of giving us the latest stuff and the new resources that they're developing. But in order for a lot of these workers to be successful and to remain in the workplace, we need to have some, of these family-friendly workplace pieces in place for them. And the goal for everybody is self-sufficiency for our workers and economic mobility. And we'll be giving a success story at the very end of this presentation where you can see this exemplified. Next. So what is the Kansas Power of the Positive? Well, it's a statewide coalition. Most of the members in the beginning were people positioned at the state level. That's what the CDC wanted. We have since moved into the Wichita community. We've been moved into the Kansas City, Kansas community to do some community level work. This is positioned at the community and societal level of the social ecological model. And so like the Department for Children and Families is more at the individual and relationship level. And this has been more at the community and societal level, which is why it's being positioned into public health. So it really focuses a lot on policies and practices at those two levels. This is a list of community agencies who've made a commitment to, and state level agencies who've made a commitment to this project. A lot of them have been involved from the very beginning for 7 years and have really done amazing things to move this work forward. Next. Okay, so the Kansas Power of the Positive. The big question that got put before us is how can we ensure that children have a safe, stable, nurturing environment in which to grow? And like I said, this is a CDC question. It's a CDC frame, and there's CDC research that's empowering the answer to all of this. So those members, and a lot of them may be your statewide groups, or in some instances, they're your groups, support family-friendly policy change. They believe that when families are successful, that children are more successful. And when children are successful, it's positive for everyone. We know that when employees go home from work and feel actualized and feel like they've got a good relationship in their work environment, that they're not having as much stress at home, and that is good for families, it's good for children, it's good for not having child abuse and neglect. Next. There's 8 areas of the Kids Are Good Business Employee Survey. So that's the name of our work group, with Kids Are Good Business. A lot of you were part of that. And Wichita State University worked with their team, their grad students and their research team, and to try to figure out, they took a lot of the CDC research to come up with, okay, we're gonna focus on these 8 areas. And there's 19 conditions that fall under those 8 areas, but these are the broad areas, and that's what we're going to talk about today. So you can kind of see on here, they're mostly all situated within early childhood. So flexible work schedule, childcare access, paid parental leave, continued breastfeeding. You can see, what these are and how they connect with your work and what you think is important, thereby connecting with businesses around their work and what the intersections are. Next, we're going to go over into a quick thing. November 4th, I presented on this on the Wednesday webinar that's been recorded, and the handouts are there. So anybody that wants to see that can. There were 4 slides for each of those areas on November 4th. Today we're down to 1. So we're doing a real condensed version of this for all of you, so that you just sort of get a thumbnail sketch of what it is we're trying to accomplish. So flexible work schedules is really important for people to be able to leave and, go to medical appointments, get kids to mental health appointments, all those, kinds of things. A lot of employees are taking 8 hours, an entire day off to make that happen. And so they're not prioritizing those things the way they would if they had a flexible work schedule. These are 2 small businesses. We selected them because they're in Colorado, which is just on the other side of the Kansas border. And Arapahoe Douglas Works saw absenteeism drop 42% over 2 years, just for kind of the reasons that I said. And they rate flexible scheduling on their employee surveys as their most, one of their most valuable benefits. And then Denver has a Johnson Moving and Storage And they are implementing telework, flexible work week, job sharing, and job turnover has just really plummeted, which saves the company a lot. And they're thrilled with all of this. Telework has become a big area during COVID-19, obviously, as so many of us are working remotely, and a lot of people think at least some degree of this is going to be what's in place moving forward. It'll be the new normal. So this employee survey is good because it's able to garner that, how your employees feel about these kinds of things. Next. Childcare, as I said, is really the heavy lift. Where we did small businesses before, these are larger businesses now. We've got the slide set up so that you can do more to smaller businesses, more to larger businesses. There's different messaging according to the Chamber of Commerce Foundation for each. But this is, you know, JP Morgan Chase found what, 115% return on what it invested in childcare for its families, for its employees. And Patagonia found after 33 years of an on-site early learning center that 100% of their moms returned after maternity leave. It just became part of their agency culture for moms to return after maternity leave, thus, you know, reducing turnover rate tremendously amongst that population, well, among their total population, and over the general employee. And then they also estimate that they have a 91% return on investment on calculable costs for childcare. Childcare is in lots of different parts on this. I know a lot of you are really interested in childcare. So the infant at work policies, which a lot of you have, it's an opportunity to talk about that. It's an opportunity to talk about flexible spending accounts on childcare. It's an opportunity to talk about community-based childcare where businesses can come together and buy off slots. It's an opportunity to talk about site-based, and our number one, as we've done our own Kansas surveys, has been subsidized childcare. There's opportunities in the state of Kansas and resources for them to provide subsidies for childcare. Next. Paid leave is getting a lot of play right now, as you guys have probably seen in the news. One of the areas that has particularly come up during COVID has been paid sick leave. We're seeing that in, say, the meatpacking industry, the meatpacking plants that had paid leave did much better during COVID than the ones that did not, because their workers didn't come sick in those very early months, you know, to work because they had paid leave available. So, so that's another thing that can kind of come up on the employee survey as we're looking at all of this. But you can see that paid maternity leave leads to 93% more likely to still be working 9 to 12 months after having a child. So all these are stats that are CDC stats that are important for us as early childhood folks. Next. Continued breastfeeding links a lot of places. We have an incredible childcare group in Childcare Aware at Kansas and breastfeeding group in the Kansas Breastfeeding Coalition, ready to mentor on our employee survey with groups of employers with employers who want to implement these things. Our Kansas Breastfeeding Coalition has created a business case for breastfeeding for Kansas that they turned into the CDC at their last site visit here, which was really exciting. So what we see is less illness, reduced absenteeism, lower healthcare costs for business with continued breastfeeding. And they just need to provide a place, a non-bathroom place, and enough time on breaks for that to happen. And actually on our employee survey in Kansas, that's what our employers selected as their first quick wins. So that was good. Employee wellness, what we discovered on our Kansas survey is a lot of Kansas employers have employee assistance programs to refer to. These improve productivity and engagement and help with safety risk and health care costs and all sorts of things. But we were doing pretty well on the last group that we sent through this. Next. Supportive resources. Domestic violence is a big one. Evergy has a plan that they're willing to share with policies and procedures in place. We know a lot of people are missing a lot of work due to domestic violence issues, and they know that too. That's been a big thing for our National Prevent Child Abuse America board. They're making sure they've got somebody from Verizon on there who is targeting domestic violence. Also predatory lending. This is a big place for parenting education. What we're seeing is a lot of our families that we're working with in home visiting and parent education are in the workplace maybe for the first time as part of trying to fill those 50,000 slots and don't have as much time for home visiting or don't have as much time for parent education. And so using the employer as an opportunity to deliver those kinds of services, either through a community-based childcare or an on-site childcare, or through lunch and learns, or just the ability to meet with families over the lunch hour for home visiting or after hours or that kind of thing. So this represents a new way to do services. And then family-friendly events. We're working on a new curriculum around a lot of this. Connections matter, and the whole connections piece at the business is becoming so important now, particularly under COVID, as people are being so isolated, and a lot of that's having to happen virtually. Next. Predictable work schedules important for childcare. A lot of our, at-home childcare providers, center-based childcare providers need a predictable work schedule. So what we're seeing is a lot of, say, manufacturing plants are on the spur of the moment adding, overtime or changing work schedules. And particularly now because of quarantining, that's happening a lot, and it's wreaking havoc with everybody's ability to provide childcare. So it's just one of those areas that we need to have a frank discussion. And the businesses that we've talked to get it. And they're trying to get there. They also know the millennials think this is really important, and they're wanting to keep those folks in the workplace. Next. Livable wages, a big thing that we're pressing here. Obviously, it'd be great to get to, a $15 an hour minimum wage. And we'll see what happens with a lot of that at the federal level too. But one of the things we can do in Kansas is earned income tax credit. Families that are making under $55,000 a year get the earned income tax credit. The United Ways of America, so all United Ways across the state are really targeting that with tax people to help our families be able to get that earned income tax credit. And it goes a significant way to increasing to a livable wage for them. Next. So what are the benefits? Why should these employers do this? What's in it for them? Why is this boost your competitive edge? Well, it's because the CDC, and we've got their documents, have done a lot toward in the research proving that implementing these will improve recruitment, it'll improve retention, it'll reduce employee absenteeism, turnover, on-the-job injury, which is a big deal for a lot of the companies that I'm out there speaking to, and you all are, I'm sure. It increases employee satisfaction, their commitment to the company's public image, and it helps develop the future workforce. A lot of you know that the fewer average childhood experiences somebody has, the better trajectory they have through life, and the better able they are going to be to have executive skills to be able to give within the workforce. It also develops the future workforce as we're doing childcare, that those kids have a quality childcare setting from which to grow in the first, before kindergarten. Next. And then there's obviously benefits for our families and for their children, which is stability in childcare, which is a huge issue now. We're seeing so many problems with second and third shift and weekend childcare, and that, this is my lens, obviously, but that, families are having to leave their kid with people they shouldn't have to. And, 50% of our fatalities in Wichita, we've shown, are at the hands of boyfriends. And it's not a boyfriend problem, it's a childcare problem. They don't have anybody to leave those kids with. Then continuing breastfeeding adds to optimal child development. It helps provide for children's basic needs as we get earned income tax credit and other systems in place for families. It helps improve parenting behaviors as we move into the workplace to deliver services. A lot of our families, I don't know that I said this, are working 40 hours a week with training on top of that, and they just don't have time. Reducing maternal depression and parental stress. We know there's links there, and that's all on the CDC stuff, and then access to medical care for children. And I'm going to race through the next slides. Okay. Sorry, Rochelle. Then on this is about the employee survey, and it just shows why we're doing the employee survey. There's a resource guide attached to it that WSU's worked hard on. The 3 leadership members of this project are KDHE, Wichita State University's Community Engagement Institute, and KCSL, and everybody's gearing hard toward this. We're now trying to recruit departments of health, local health departments to help us with this, pathways programs through Blue Cross and Blue Shield, and now you all to help get all this information out into the community. Next. And the employers that tested this survey say this helps you understand what your team is feeling and how you can be supportive. We completely thought we'd get pushback on the survey, that they'd say, reword this, redo that. And we didn't get that at all. We've done 2 cohorts now, and people are appreciative. A lot of times you've got people at the senior staff level administering this survey. They're not in touch with what the needs are of their frontline staff, and this helps them to understand that. Next. And our mantra is strong families build strong businesses, but that as I've been out talking to chambers and Rotary clubs and et cetera, strong businesses also build strong families. Next. Here we go. This is a success story about, agency work with one of our unemployed that then, the business, the employers, what they did to create family-friendly workplaces to help make this employee's story a success for them and their children. Turn it up.
By the time I was 16, I was out of control. And I just started going with the crowd, partying with my friends. My grandma did try to do the best for me. Now that I look back at the craziness that I've lived since I was a kid, I shouldn't even be sitting here right now. A walking miracle. My grandma, which was like my best friend and my mom, she died of cancer. Like his mom died, my son was 5 weeks old. And McKenna was about 16 months old, I think. I had no support system. I can't even find a babysitter to go look for a job because the state, they require you to be working for 5 weeks before you can even get daycare assistance. Stressed out, extremely stressed out. I was overwhelmed. I wasn't sleeping at night. Somebody said, oh, we want you to come talk to KCSL, this place over here. And yeah, they actually gave me some hope. I got to go to a parenting class that they offered there and learn how to take care of 2 little kids, babies, by myself. It was either me or they go into the state custody. I also was dealing with a lot of anxiety and depression. I did the therapy. In fact, I still see a therapist there now. has helped me a lot, just having somebody to talk to. KCSL is amazing. They're kind-hearted. They're very understanding. They actually care. Every time I had an appointment there, they had a kids daycare set up. All the workers were extremely nice and caring. All in all, a great place. I'm very grateful. My kids are too. Without their help, I probably would have never went to college. I really don't know what I would do. I mean, if you think about it, I probably would have been homeless with my kids. Through KCSL, I got to go to school. They paid for my daycare for over 1.5 years, so I can go to school and look for a job. I think highly of my employer. They're giving me a chance. I'm very grateful for the opportunity there, and I'm learning a lot. If you work hard, they actually appreciate it. They're like, they tell me they appreciate me all the time. I have never worked for a place that's made me feel this valued. Being a single parent has been extremely difficult. What do you do if your kids get sick? What do you do if you have to go to the doctor, or your car breaks down and you have a car appointment? I mean, life happens to everybody. If you got kids that get sick, they can't go to daycare for 24 hours. If I didn't have the support of my employer, then yeah, I probably wouldn't have this job. So I'm very grateful to my employer and to KCSL. A lot of places I've worked, they just say, oh, we'll just get some other temps in here. We'll just get somebody else in here to do it. Who cares? Fire you at Christmas. Realize that life happens to everybody. If you've got yourself somebody that's a hard worker and not trying to take advantage of the system, then try to work with them a little bit. With KCSL's help, I've been able to get a job I really like, and my kids are happy. We've got stability in our lives. My son is in kindergarten. He's in pre-K. He's extremely smart. McKenna is going to Beach Elementary, and she's extremely smart, and they're both happy little kids. I've been able to save now. I'm doing good. They're in school full time. They're happy. We've got a nice house in College Hill. It's been a long road and a long journey, and without KCSL's help, I wouldn't be here today. Now my kids are going to see a dad that works, a dad that doesn't drink or party, some stability, and then a dad that dedicates the rest of his time to them and no one else. I mean, it's just me and my kids, and I like it like that. They'll have a future, and then they'll be able to hopefully live a better life than I did. I'm sure they'll appreciate it, how much I've changed my life around for them. Thanks for helping me so much with my kids, and thanks for helping me have a future. I'm very grateful. Thanks.
I took just a couple notes. I think I have just a couple minutes, Rochelle, on our little schedule. That you could see so many of the family-friendly workplace pieces at work here in this story. You know, the flexible work schedule was incredibly important to him, that his employer, which is the aerospace industry, was able to provide him opportunities to get mental health services, you know, for him and his children, you know, which is so critical for so many of our families. Paid sick leave was a big deal for him. And so his employer obviously provided that, which helped make things work for his family. Childcare was a big deal. And to be honest, that childcare is through Crisis Nursery in Wichita. That's a program that the cabinet funds in Wichita, so that families that are in the situation that he's in can get job training, can, you know, get those first few weeks on the job, you know, before they get a paycheck or childcare assistance, whatever it is that they're waiting on, because so many times those are the barriers that our families can't work through and can't make happen for all of us. And then the livable wage thing, you could see he was able to get stable housing. He was able to get, we know, a stable school setting for our kids. He was able to have a stable school setting for his children, you know, to be able to thrive in. So all those things were things that were, you know, provided by the employer, but the agencies, all of our agencies, you know, are kind of making a concerted effort right now to get our families into job training and into the workplace. And this is, just one example of a success story. And this will be available, as people make presentations to Rotary clubs or chambers or whatever in the community, so that business can understand why this stuff is so important to the families that we're serving.
Okay, thanks, Vicki. So thanks and good morning, everyone, for having me. My name is Rochelle Soden, and I'm a training specialist that works under Vicki Roper on a variety of projects. And so I'm just going to take a very few brief moments to just kind of tie what Vicki talked about into what does this really translate? What are kind of next steps? What do they look like? How do you take this into your communities to use this? And what does that look like? And the slide that's up right now is talking about when children thrive, we all benefit. And that really is kind of the overarching theme of what we've been talking about this morning, all the work that you all do that you know. And one of the ways that the Kansas Power of the Positive makes this kind of easy to do is to help engage and train vested community partners in how to approach and talk with businesses in their communities about the importance of these family-friendly workplace areas and then the connection between families and businesses. So one of the areas they work in is helping to equip through a training of trainers to enable you to take this information to approach your businesses and your areas to be able to talk with them about these important areas. And so I'm just going to take a couple moments, you can go to the next slide, Debbie, to talk just real briefly about what that would look like. So we will be doing a training of trainers in early 2021, which Vicki talked about in the very beginning. But what we will be looking at from that training of trainers is just doing a sample agreement with those who are wanting to become trained, and kind of the areas that we'll be agreeing to do in partnership is from Kansas Children's Service League side, we'll be providing that training of trainers and provide you the toolkit, basically all the PowerPoint versions and the handouts and the video that was just shown. We'll provide coaching and supports as needed. So if you get trained in early 2021, but you don't approach a business for 4 or 5 months and you want to refresh, we will provide a coaching moment with you so that we can go through those slides so that you are fully equipped to be able to talk to businesses about these areas. And then we also collect and maintain the training report data, which is in conjunction with WSU. And then from your all perspective, we would be asking that if you go through the training of trainers that you commit to completing 2 trainings or 2 presentations in your local community. So you are looking at approaching whether that's your own business and agency or another one that you partner with. You'll be utilizing the handouts and the things that we would provide you, so you don't have to worry about creating any of your own handouts or your sign-in sheets or evaluations. We have all of that for you. And then we would just ask that you submit that information back to us when you have completed a presentation so that we know who you've approached, who you've talked to, and we can collect that into our data. Debbie, you can go to the next slide. So the goal really of the training of trainers is really to equip partners so that you can provide these topics to your own staff and your own community partners. And we are really providing the tools and the knowledge for providing these trainings in your own communities. And we will be providing tips for managing the delivery, because as you know, not everyone has the natural skill set for doing presentations. Not everyone's completely comfortable talking in front of groups or in front of entire staff. So we'll help talk with you about how you can manage some of those things or some of those hesitations potentially. Next slide, Debbie. So some of the things, I'm not going to spend a lot of time on these slides just for sake of time, but we include things in this training of trainers that talk about becoming basically an expert trainer. You know, as many of you know, you all probably know that, you know, good teaching requires practice and feedback. And so it's important that, you know, we don't just pick up the training and go right to the presentation. We've looked it over, we know what we're going to be talking about. It's a learned skill, as many of you know, and it sort of practice makes perfect, although as many of you probably train and do presentations the way most of us do, which is where we're always, you know, responding to the needs of the group. And so we have to also know the materials well enough to be able to pivot and tailor it to how the group is kind of guiding us. Next slide, Debbie. So basically your role as a trainer after you've gone through the training of trainers would be to just know what your community resources are and know what current events are happening. It's super important to know what is impacting your community that you are presenting at, or if something is impacting that particular business. Practicing, we'll cover things like time management, where you can make up time, things like that. And then the bottom line that I always like to say for those going out and doing training is, the responsibility of learning rests with the participant. And that's no different here, although we will be prodding a little bit for businesses to implement that survey to, try and gauge what their employees are saying is important that they would be finding beneficial from those 8 areas of Kids Are Good business. So yes, the learning does rest with the participant, but we will also want you to be prodding those businesses to say, maybe in some follow-up, hey, have you implemented that survey? Did you get any results back? Have you thought about areas you could implement that would make your place more family friendly? Next slide. And so what we're going to do to just think this through a little bit further is, Debbie, I don't know if you determine what the best option was for this, if we're going to go into smaller breakout rooms or what size we're going to do, but we're going to do some conversation and some reporting back.
I have the breakout rooms set up with about 4 to 6 people in each group.
Okay, and so based on time where we are currently at, I think let's cover question 1 and 2 in the first breakout room. So really what we're wanting to have you discuss in your small group is, how does this tie into the work that you're doing? So probably introduce what your agency is, what the work is you're doing in your community, and then how would family-friendly workplace modeling work within your direction? And then who in your community do you think you would be able to target with this presentation, or who do you think would be someone that you could approach? And then probably take about 10 minutes to cover those 2 questions. Debbie, is that what we've got it set for? And then we'll come back with a report out.
Yes.
So
yes.
Take notes, someone be a scribe and take notes and plan to report back.
And I went ahead and dropped those questions into the chat bar so that you've got them with you. Before we all head out, Michelle, I saw that you had a clarification around childcare subsidy. Would you like to share that with the group?
Yes, and I don't know for sure if that video that we watched, if he was referring to childcare subsidy, but we don't have anything that requires a person to work for 5 weeks before they qualify for subsidy. And we also support job search through our employment services for both TANF and food assistance recipients. So I wasn't sure what happened to him, but I just wanted to clarify that.
Yeah, thanks, Nisha. That's helpful. No, I don't think he was referring to that. But one other thought that I had is the employee survey only takes 10 minutes. It's 2 questions. So that question has come up too.
Okay, are we ready to go into breakouts? Okay, wish me luck.
Debbie, I plan to share my screen and just put a little, like, we'll be back in a few moments for those who are on live stream. So I'll do that here.
Hey, Debbie, do you want me to just come back in after I just hopped on from my other meeting? It's Christy. Or do you want to stick me in a group, or?
Do you want to, I can stick you in a group if you want me to.
Sure, that's fine.
Okay.
Hey, Debbie, this is Mallory Arlano. And I had to reconnect earlier, so I'm not in a group either.
Okay, let me get you put in one.
Are you seeing that screen, Debbie, with the recommendations panel members are currently in breakout
Yes,
rooms?
okay.
Great.
Yeah, thank you.
Perfect. Yeah, no problem.
I think it looks like we have everyone back, Rochelle.
Awesome. Okay, so I think what we want to do is just have a report back from the groups. And Debbie, remind me how many groups there were? Do you recall?
There were 8.
8. Okay, so if we could just have a quick summary from each of the groups, just in terms of what you thought about, and that would be great. So do we want to just start with group? I don't even know what group we were in. So Debbie, you might have to be the one to holler that out.
This is Chelsea Schulte. I'd be happy to start. Our group, I'm with Casito, and Revo was also there with Child Care Aware. So we talked about what this might look like from this perspective of reaching child care providers, and that part of our work might be looking at how do we help child care providers have the language to be able to communicate this information in their own communities, and how that relates to the supply and demand. And also the idea that we would not be, as a trainer, we would not be fully responsible for every request that comes to us as a result of our efforts, that part of that work is making connections for KCSL.
I think we were group 2, so I'll jump in. I'm Dee Rankin. In our group, we talked about how this tool fits really perfectly with some of the things that people are already trying to do with their chambers of commerce and that type of thing. We had a really interesting conversation around to not think of this as perks for employees, that this is actually how you create an equitable workplace, and that staff chooses to stay or leave based on these types of things. And if you want to retain quality staff, this isn't benefits for your staff. These are things to put into place to actually retain people. And even within our group of 5 people, there were varying levels of the supports that are provided by employers in these 8 areas. We talked a little bit about how there's parallels between how you support your staff, and if you're working with the community, how your staff then is supporting people in the community. And then we had some conversation around small businesses, and it might seem like this is a difficult thing for a small business to do, but there's creative ways to partner with other people and other entities in the community to help support some of this. And so there's messaging around how, if you're a small business, you can adopt some of these things for your employees.
I'll go next. We were actually in breakout group 1. We had a home daycare provider and a learning center director with us. So they're both really tied directly to this work. We had a lot of conversation around people that are there taking care of the children, for the families that are out going to school and working, that the flexibility for them is not there in their work schedule. How do you support those that are doing the work that are supporting our families? We had a lot of conversation about that. It's hard for them to have flexibility in their schedules because they have to be there for the other families. We also talked about childcare subsidy a little bit, and how there is other childcare subsidies out there that exist, but it's really hard for families to find, and complicated process. And usually they can't do that on their own. They almost need a case manager to help them really dig out the opportunities that are there for them. And it is the impression, the general impression or perceived norm that you do have to be working or be going to school in order to qualify for childcare subsidy. For question 2, we talked about, especially for the Learning Center, that it would be important for them to partner with employers in their community, because it's really a win-win situation for the Learning Center and for the employer if they were to partner to have childcare for the employees of that business. So to get out there and really partner with the employees, employers in their community.
I'll go. We were group 3. We had someone from Child Care Aware and Tiny K, and then the 2 parent representatives. We talked about how Child Care Aware provides data for parents that are working, trying to find childcare for their kids, and how they help provide productivity for the workforce, by providing training and things like that. And that, then they work with Child Care Resource and Renewal as partners. And then Tiny K, they employ parents, and they've discussed on-site child care, but they found barriers for that. They provide flexible schools or schedules for the family, for their employees, and provide space for breastfeeding. They also provide flexibility to the parents that they serve because of their work schedules, or schedules needing to take their children to medical appointments and things like that. There was discussion about Tiny K wasn't sure that they had the ability to present to businesses in the community, but then we kind of discussed looking at the industries that their families are in, and maybe reaching out to them with messaging to see how they might be able to help within their industry to help the families that they serve.
I think I was defaulted for group 4, but if any of you want to chime in from group 4. So we talked a little bit about just that, especially from a DCF perspective, we have recently some resource navigators, which can help to some of the things that you've already talked about as far as connecting families, identifying that we have a lot of employers who have shift work, and that is definitely a need from a childcare perspective. We do not have a whole lot of childcare providers who provide evenings, weekends, overnight options, and so maybe reaching out to those employers in particular. There was also some discussion about, a lot of discussion really about that, providing technical assistance to employers who are looking at or are interested in providing childcare, whether that's on site or working with quality childcare providers, and that there's currently some work being done around that and getting that information out to employers. And then for question 2, there was some conversation around that there's some communities that are working through their economic development, through their chambers of commerce around cradle to career. And so that's also a possible place to connect with some businesses who might be interested in looking further into this.
Hi, this is Mallory Orlano in our group. I know that Paula and Amy were in our group. I'm not sure about the other names, sorry. And they can chime in whenever. But there is a lot of great points brought up in our group. I thought it was great because we were talking about how Amy, I think are you like the director for, I can't think of it. Sorry, Amy.
That's okay. I own a child development center in Lawrence.
Yes. Okay. Thank you. She's talking about how, we're not going to have fully funded childcare. And so we were talking about partnering with the parents, employees, with childcare, trying to figure out that balance so that, we're getting the money in from places just to help it more affordable for parents and and ideal. And then I talked about how, so I'm in Garden City, Kansas, and we have a huge Tyson plant. And I know personally, as a mom of toddlers and working for the school district in this area, we don't have enough childcare options for everybody. And I know that somebody was talking about retention. That's a huge thing for all employees out here, like the hospital, for, you know, just the school district too. A lot of people communicate, and it's been communicated forever since I've lived here, that we need more childcare options. And that's why, you know, that's one of the top reasons why people are leaving. So I feel like I would love to be a part of helping that with our area. I'm just not sure where to start. We talked about, you know, talking with our Chamber of Commerce or the city commissioner. But, and then how do we reach like big companies like Tyson? Because like a lot of those people that work there, they either get let go or they're having a hard time, and there's a lot of pushback on, you know, if they have to stay home with their child, if they're sick, or, you know, during this pandemic, being quarantined, it's not ideal, and they're just kind of seen as replaced. And so we talked about how like some of those positions, like it's a lot more work when you're trying to retrain somebody. Some of them not so much, but anyway, that was our discussion about, you know, how do we start this to help the whole community, as everybody here is affected. So it's nice that I can see that myself as a parent and as a former teacher in the district. Like I know how hard that is for parents, and it's always brought up, you know, when I've had those parent teacher conferences and talking about those things, it's a struggle for parents. And it was always a struggle when I taught at the Early Childhood Center, because think about how the child is only going for 3 hours. What is happening with them the rest of the time? And so that's where we had a lot of issues trying to get that child in childcare, because, or in our early childhood center, because the parents are like, well, I work all day, so I can't just come pick them up. Nobody else can pick them up. So what are we going to do with this child? And trying to work with the community. And we do have community options through our daycare and through the YMCA, but those are only 2 options. And we're smaller, but we have quite a few people. And like I said, it's just not enough childcare for everybody.
Did that get all the groups?
No, I'll go maybe last. We were group 7, and it included Casito, Links to Quality, and then a local coalition. And our discussion went around a lot of the recruitment and retention. Links to Quality has a startup specialist position that recently started that's looking at recruitment and retention of childcare providers. And then ITSN for Casito has some of that also going on. So we looked at how we could serve as, because we have local members, community consultants or ITSN specialists who are on the ground locally or regionally, and who could be using possibly for requests from businesses or chambers to be able to forward that information on to them and get them some additional supports that way. And just partnering with businesses to help with that childcare need that's in most communities. And then the coalition was their focus is based on families currently, and how they could possibly look at that. And then to question 2, we did kind of have a question about who the target audience of the presentations were, but our thoughts were that possibly the Links Quality consultants and the ITSN specialists, being they're community-based or regionally based, and then possibly local chambers of commerce were people that we thought could be targeted.
And we're group 8, so I'll go ahead and share out for our group. And I had Amanda and Sheila and Jennifer in our group, and ours it sounded kind of similar to Mallory's group. And I work with Vicki Roper in the Wichita area with this work, and we kind of discussed how and where we fit with this work. And I kind of mentioned with the way we do it, it's kind of, you know, I may help with, whether it's a media interview or just connecting with a person in the area to discuss it with them, or doing a presentation, or just, hey, let me reach out to this person and I'll send them over to Vicky, or, just kind of, where do you fit? How can you help? And who can we connect with? And, Jennifer was kind of asking, well, I'm in the Kansas City area. Who's doing this work? Where do I fit? And just get with whomever in the area. And she mentioned even Paula Neth, and I'm sure, just reaching out to her, she'd be happy to say, hey, here's who we need help with. And so ours was more of a discussion on where do we start? How can we get this going? And in the Dodge City area, Sheila, I already hear Mallory talking about who she can connect with. And that's kind of how our conversation went, is who, where, what, how, and just getting out there and supporting and what we can do to get the work going. So, and that's kind of how we do it, I think, Vicky, is get everybody we can and share the wealth and the knowledge and spread it out.
Yeah, I think we'll share that in the Train the Trainer about in Johnson County. For instance, the local health department's very involved and they're serving that entire Kansas City area. I mean, there's different people moving in to take on the work in different regions across the state. And Paula Nath is very much involved in the coalition up there. So yeah, someone from the Kansas City area was in my group and we're going to connect. I'm meeting with the KCK Chamber on Monday. So yeah, it's going to be very helpful to combine efforts on all this.
And there's room for everybody and anybody who wants to.
That's right. We need everybody. We're obviously looking at a culture change here, and it takes all of us to do that.
Yeah, that's awesome. Thanks for those transitions, you guys. Those were great to moving out of our reporting out, because it absolutely does take everyone, and everyone is welcome to the table to figure out how to utilize this information and to move the information forward. Yes, Reva.
I wasn't sure if you could see me.
I can.
This whole screen thing just, so this is awesome information and I would love to see it get out there broadly. And I love your train the trainer approach. What I'm trying to wrap my head around is, okay, so you take this presentation, or someone takes this presentation out, talks to a business leader or talks to a Rotary Club or whatever, and at the community level or at that individual business level, they say, yeah, we've really got a problem with this, whatever it is. So how does that information then get pushed back out to the entity or organization or group that works on that particular issue? So that's part of my question. And it really came to mind as I was hearing people talk about promoting on-site childcare, which can be the best solution in some cases, but it certainly should not be an automatic default. I think we want to support our community-based childcare programs across the state that are already out there, if that's a feasible option. And I know it'll be different in every community. So I was just trying to, in my own head, figure out that process for, once a need is identified in a community, whatever it is, how do you loop in then the other agencies or entities that work on those issues?
Well, that's there's one of the places on the report form that talks about the impact of the presentation, where you can report back in on what questions came up afterwards, or what happened at the community level after the presentation, and that'll come back to KCSL. In some instances, we push that out to WSU. They've developed a resource guide where they can get, and you guys will, whoever goes through the Train the Trainer will have all that as well, can get more information. In some instances, you're probably identifying something that's very community-based to work on. And there's a lot of ways that can go, and we will talk about that in the Train the Trainer. And this work is evolving, and under COVID and doing it virtually has its own set of concerns and issues. So it's not like we have all the answers right now too. This is evolving and you all will have input, and there may be new solutions to these problems as we're all working together on this. That's part of the value of collective impact. No, there's no cost associated with the Train the Trainer. My guess is it will be virtual because we're looking at January, February, or March, and the CDC pays for our time to do that, and so we're fine. There's no cost.
I also want to just tie back into Riva's questions just to kind of give the overarching kind of steps again. So there would be a training of trainers where you would be able to basically become familiar with the information, how to take it out to your communities. You would approach, businesses or whoever you've identified to present this information to, so that you're making that connection between businesses and families and children. And then from that presentation, the hope is that that business will connect to the survey where they could administer that survey to their employees. They can find out what their employees are saying is important or an identified need for them to make that business more family friendly. And then those results, we don't, Vicki, you can correct me, but we do not have any direct impact on those results. Those results go back to the business. So that's up to the business to administer the survey, get their own results, and then start to choose how to implement those family-friendly policies that they have identified.
Right, and the business could be your employer. I mean, you could start with your business so that you know what this is and can move this work forward into other businesses. Casey Sell did that, so I totally get that and the need for that. But yes, that is absolutely correct.
Okay. So for sake of time, we knew we probably weren't going to do questions 3 and 4 that are on the slide, but these are things that you would want to be thinking about, coming into being a partner to use this information. And then as part of the training of trainer, Debbie, if you want to go to the next slide, we would have you just start thinking about, how do you use this language? How do you approach a business and just pitch a 30 to 60 second elevator pitch, talking about the connections so you can start to get your foot in the door with some of these places. Maybe it's your own business, your own CEOs, if you are not one of the CEOs. But then how do we start to move this out into the business? So we will talk more about that in that training of trainers as well. And so really the next steps are, Debbie, if you want to go to the next slide, are really deciding, if this is something that you want to utilize, which it sounds like many, if not all of you do. And so if that's the case, then shoot an email to, it looks like Vicki has me collecting that at the moment, so we can collect who's interested in attending that training. Which will be in early 2021, somewhere in the first, 3 months. We haven't determined what month yet. But once we have that list of who's interested, we will then send out a doodle poll to figure out the best date that's going to work. It will almost assuredly be done virtually, so there won't be any travel involved. But then we will get that scheduled and we will get this information to you so you can start to utilize it. And so I think the next slide just is our contact information. If you have questions, you can certainly reach either of us with questions, but I know we are a little bit over our time. And I believe, Debbie, you said there would be a break for everybody before we went into 1-800-CHILDREN. So I don't want to go any further.
Fantastic. Thank you, Rochelle. I am really impressed, everybody. We were able to have, I think, a good, thoughtful conversation and convey a bunch of information. We are going to thank you, Debbie, for your leadership and making sure that we had a break scheduled in. We are going to be back at 10:50. We'll have plenty of time for conversation. We'll shift into our next topic. So if you have additional pieces to share or questions on this piece, be thinking on them on your 5-minute break. I will see you all back at 10:50. All right, everybody, my clock reads 10:50. It feels like that 5 minutes went really quick. I see that we've got a couple people back. Fantastic. So I know that we just went through a lot of information. As I was transferring, I now have hot tea instead of lukewarm tea, which I'm pretty excited about. And as I was boiling the water to think about that, you know, we heard a lot of information. We had this presentation because we wanted to have a better understanding of the work that's already going on. Think about how we as panel members and how we as a state system can support it. And really think about how when we're trying to do work, how we can make sure that we're building on what's already there instead of trying to reinvent a wheel, right? Instead of trying to say, okay, how do we put together the business case for early childhood? How do we start from a foundation of something where there's been some good work already and build on that? So I hope that everybody can take a minute to kind of jot down or think about, we're not going to have full group discussion on that piece, but I hope that we can have our kind of systems thinkers hats on and be thinking, okay, how do we use this as a panel to really move forward the work that we've been trying to do? How do we support it? And how do we want to build on this in the future? We also, so the second presentation we're hearing today, we really appreciate the Kansas Children's Service League team for really doing some heavy lifting when we were trying to pull this together. Because we wanted to make sure that everybody was aware of another resource, 1-800-CHILDREN. This is something that's been around for quite some time, and there's really exciting work going on right now to make this an even more powerful, even more important resource for Kansas families. So we really wanted to engage you all now at a really critical time to help inform and move this work going forward as we launch some pretty exciting things in the next couple of months. So I will turn it over to Pam Noble and Stephanie Boone to be able to present on 1-800-CHILDREN.
Thanks, Amanda. Good morning. Thanks for having us as part of your panel meeting this morning. I think Debbie has our slides. There we go. So we are really excited to talk to you about the 1-800-CHILDREN project. As Amanda said, 1-800-CHILDREN has been around for a little bit, but we've done some new work. So you'll see on our next slide that when we had the original preschool development grant, we did a needs assessment, and that really showed us that families across the state needed a way to connect the dots. They needed some additional navigation. It's not just about having a phone number of where to go. It's about having someone who's going to help them connect those dots. So that's where 1-800-CHILDREN came into play. It's available 24/7. We answer in the office from 8 to 5, or actually we also have our staff. Last March when we had our original stay-at-home order, we have the ability to answer. They have the ability to answer their phones using a headset from their computers. So that has really helped us keep our staff healthy and keep them safe as well. So that was kind of exciting. And we do answer, like I said, 24/7. After hours, and weekends, we have an extensive volunteer project that helps us to take those calls. They're highly trained, and lots of them are retired from the human services field, or some of them are just getting started in the human services field and need some additional hours. So we can provide them with a variety of supports and services. A little bit of a brief history. When Kansas Children's Service League became the Prevent Child Abuse Kansas chapter in 1992, the Parent Helpline, as it was called then, rolled to us. Having a 1-800-CHILDREN line is one of the requirements of being the Prevent Child Abuse America chapter. Kansas was the first state to have their own chapter 44 years ago. So we have long stood in being able to help our parents. We have a great collaboration with a variety of different state and local agencies. We serve youth as well as families. We had a contract with the Kansas State Department of Education a few years ago to also provide bullying prevention services and supports for both families, students, and staff. Recently, we have undergone a new reorganization and rebrand, and that's kind of what you're getting today. So our reorganization, we hired a supervisor, Stephanie, who's going to take you through some of our new resources in a little bit, and then 2 additional call line staff. We have 4 total. You can interview and hire during a global pandemic. We did it. We were a little Zoom exhausted to begin with, but we have found some really great staff. One of them is bilingual English-Spanish, and we are really excited. They all come kind of at different levels of their parenting experiences and are able to really provide some great information to people that call. We updated our resource database. It's 1-800-CHILDREN-KS.org, and Stephanie will walk you through that in a little bit. And we've also updated our workflows a little bit so staff can follow up. Our line is always anonymous if you choose it to be, but in certain instances, we do have families that want some follow-up, and so we're able to offer that. If they don't want it, that's fine. They can remain anonymous, but for lots of our families, they do need that extra support, and we can follow up with them. Our rebrand, you can see it there at the top. We worked with Trezolo, who also did the All In for Kansas Kids campaign. They started last spring doing some focus groups with parents and professionals, again, virtually. And a lot of those happened over the phone because a lot of the families that we serve don't have high quality internet services, especially out in Western Kansas. So Trezolo was able to navigate that through support or focus groups over the phone. We updated our branding and our language, and we're working on our full marketing campaign. And then this says today is our official relaunch date. These are from the November 4th Wednesday webinar, which was our official relaunch date. So we have been working to relaunch, increase awareness across the state. We have lots of brand new marketing materials that we're working on getting out, as well as informing people about the new database. So I'm going to let Stephanie go ahead and talk about the line and the database and her staff.
Thanks, Pam. So we really view the call line as a complementary support to the support that already exists for children and families. And our logo is it's a really great visualization of this. So you can see that heart in the middle, and that represents the child. And then there's various layers of support that are really wrapping around that child. So you would have their family, their community, those community organizations. We really see ourselves as just another added layer of support for that child and that family. So our goal is to come alongside community organizations and individuals who are already supporting families. And in this way, families are going to be able to seamlessly connect with the resources and support they need 24/7, and even if they just need somebody to talk to. On the next slide, you'll see that there are 4 ways that a person can access support. The first is by calling 1-800-CHILDREN. This is answered by a real person 24/7. Even at 3 a.m., you will get a perhaps groggy, but a real person that is just there and available to talk to whoever calls. You can also send an email or a text to 1-800-CHILDREN@kcsl.org. You can visit the 1-800-CHILDREN-KS.org site to find resources. And then we also have a mobile app, which would be the mobile version of that 1-800-CHILDREN-KS site. Now on the next slide, there are 4 things that staff aim to do when somebody calls in. The first is to approach every caller with the same mindset that we are in your corner. So our focus is the person calling and doing our best to support them, whoever it is, whatever the situation, wherever they're coming from. We're really looking to come alongside them and support them. Secondly, after we have an idea of the question that prompted that caller to call, we would try to offer support or advice that can help them in that moment. So often that would be maybe some parenting advice. Often that's reassurance, that's validation, that they are a very good parent going through a hard thing. Because sometimes it can feel like going through a hard thing means that you're a bad parent. It can feel that way in the moment, and it's good to remind them that they're doing a good job. The next is that we're going to look for support or resource that can help that person moving forward. So after they end this call, what can help continue to support them? And this is usually where we're going to start looking in our resource database and connecting them to a community resource that's local to them. And lastly, we would offer to follow up with a caller because we want to make sure that they received the support that they actually needed, that they were able to connect with that community organization. Like Pam mentioned, callers always have the option to remain anonymous. And so the follow-up will offer it. And then, callers can decline if they would like to, if they'd like to remain anonymous. So we're gonna, in just a moment, we're gonna take a closer look at the 1-800-Children resource database. We completed a comprehensive search and review of available resource directory software, and we identified Aunt Bertha as the best software solution to meet the needs of our state. One feature that really drew us to this partnership was that they have a dedicated team for continuous updating and verification of resources. So once a resource has been added to our site, it is reviewed for needed updates by a real person at minimum every 6 months. So in this way, we're able to ensure that all those resources are reliable and up to date. So you can see here the home page. And there's a field for your zip code, or it would be the zip code that you needed to find resources in. On the bottom left-hand side of the page, you can see that you can translate this website into over 100 languages, and users can also search in their native language as well. There's also buttons here on that home page. You can see the blue phone with a little email icon. Users can click those buttons to call, email, or text to get in contact with staff. So once you've entered the zip code, you can then use the search bar or the category bars to find the resources that you need. And at this point, the database has already filtered the resources so that the only resources that will come up are ones that serve the specific zip code that was listed. So once you've found the category of resources that you need and you have a list, you can continue to filter the results if needed. You can use personal filters, such as the age of the person that's going to be served, program filters, such as whether or not the service is free or if they're open in the evenings. You can also specify if the program would need to offer services in a specific language. Next, you can review the resources that met your criteria. The provider card lists the program along with some basic information such as the services provided, who they serve, and how to contact them. For additional details, you can click the More Info button, and this gives information such as the languages that services are offered in and if there's any eligibility requirements. And anyone can also click the Share button on that provider card, and you can email or text the information from that program to yourself or someone else. The resource database, like I said, can be translated into multiple languages. So there's 2 opportunities that you have to do this. The first is on that home page that I highlighted. And you can also do it on the following pages. There's a select language bar that's located below the search bar. Additionally, a lot of thought was put into ensuring that the resource database was accessible to all of our families and providers. So our site is understandable by screen reader. It contains text versions of all visual information. It's visible to those with visual impairments. We did this by paying really special attention to the contrast and the fonts that we used on our site. And it also contains no elements that would detract from the experience of deaf or hard of hearing users. We have spent the last several months transitioning all of the resources that were in our original directory, which was over 5,000, to our new 1-800-Children resource directory. But we do know that we have a lot more work to do to ensure that our resource directory is robust and comprehensive. So after the webinar, I encourage each of you, if you represent a program, to visit the resource directory and make sure that you're listed and make any necessary updates. I'm going to go through quickly how to check and see if your program is in there and how to make some updates in it if it's needed. Please don't feel like you have to write all this down now. I believe a quick reference, the provider quick reference guide was provided to you in an email from Debbie. If it wasn't, we can certainly get that to you. So like I said, we had a pretty extensive resource directory previously, so there's a good chance that your program may already be in the resource database. To see if your program is listed, you can use the search bar to search for your program, or you can go to 1-800-Children-KS.org/find-a-program. So if you find that your program is listed, but it needs an update, an easy way to do that. And on the next slide, you'll see those steps. On the program card, you can select the Suggest button that's toward the bottom. It'll open up a pretty simple form. You include your email and then write what the suggested update needs to be. And the data team will typically have that update verified and uploaded within 48 hours. On the next slide, it's possible that maybe you can't find your program at all. If that is the case, then we definitely would like to add it. On the bottom right-hand corner of the web page, you will see Suggest a Program. This will open another window. You'll fill out as many details as you can about your program. The data team will review and add the program, and they will follow up with a confirmation email. And if you would prefer, you can claim your program, and this gives you access to do all of your own updates. So you wouldn't have to suggest it and wait for the data team to update it for you. In the lower right-hand corner, just to the right of Suggest a Program, you'll see Claim Programs. So by claiming your program, like I said, you can do your own updates, and you'll also have access to some simple data metrics related to your programs in our site. On the next slide, you'll see that we have a mobile app. It's available for free download on the Apple and Android stores. And you can search it, just search 1-800-Children-KS wherever you purchase your apps. On the next slide, we also have a quick reference guide for providers that I had mentioned. This document goes step by step through how to update, add, and claim your program. This will be the same things that I just went over. We also have a search bar that can be directly embedded on a partner's website. So when a person types in their zip code into the search bar, they're redirected to the 1-800-Children-KS site, and they're able to find resources in their area. My email will be at the end of this presentation. So if I talk about something that you're interested in adding to your website or to your materials, please just send me an email and I will get that out to you. And we also have a bug graph that can be placed in emails or other electronic materials. When someone clicks on the logo, they're redirected to the 1-800-Children site. We also have a family outreach card. It's available to share electronically at this moment. And this just gives a rundown of what the line is and how to connect with this available. We don't have this printed yet, but we will disperse it widely once we do. If you already partner with 1-800-Children, so this would have been formerly the parent helpline. This is a really good opportunity to update the logo that you're utilizing. So again, you can reach out to me via email and I can get these updated logos to you if you need them. And lastly, I just wanted to share some bright spots, some examples of calls that we've received. These would be in the past couple of months, actually. So we had a call from a woman who is currently homeless. Staff were able to find some resources for her, but she didn't. In the past, we would have asked the caller if they had a pen or paper to write down the resources that we were giving them. This caller didn't have anything like that handy. And with the new features in our resource database, we were able to text them straight to the phone that she was calling from. So she had directions via Google Maps, she had hours of operation, contact information, everything that she needed to connect to that resource database or to that community resource was there on her phone. Next, we had a staff member, or we had a mom that called in who was struggling with her 3-year-old's behavior. This 3-year-old was transitioning away from taking naps and was pretty crabby by dinner time, and mom was really struggling with that. So Colleen were able to reassure mom. Together, they talked through some things that mom could try at home. And they were also able to connect her to a local parenting class that she could attend. And the last one, we had a mom that called. She was actually in the middle of a panic attack. Her baby had not been sleeping well. She didn't have support at home. The staff were able to help her calm down. And they talked through some ideas that she could try to help her baby sleep better at home. And they also provided her with a local parenting support group so that she could have that support moving forward. And I know this call in particular, staff spent 45 minutes with this mom on the phone. So they really took all the time that mom needed to really listen and support her in that moment. As part of the relaunch, we're conducting outreach and presentations to numerous early childhood groups. And something that we wanted to hear from this group is, are there any groups, agencies, or organizations that this group would recommend us reaching out to as part of this process?
So would it be helpful, Stephanie, for us to take a pause here and have this group either ask any questions or share any recommendations for which groups should really definitely hear this message and be aware of this resource?
Yes, yeah.
Is there, this is Peggy Kelly, is there or do you have planned a brief like video that could be embedded in different places that would just be kind of cover this information but from a parent's perspective to say, hey, having a tough day or have questions, and just kind of walk through some of the information you shared in a way that would invite a parent to maybe click on a link or make a phone call?
We haven't thought about a video yet, Peggy. That's a good idea. Thank you. We do have a, I think Stephanie showed you, you can embed on your website to search that will take you right to take you right to 1-800-CHILDREN. But we haven't thought through if we, something more interactive. So that's something for us to think about. Thanks.
This is Emily Barnes, the family child care provider. I'm wondering what has gone on in the way of making sure that providers, child care providers and centers in Kansas are aware of this to be able to offer this as a support to our parents who receive service from us.
We are in the early stages of our marketing campaign and developing the materials. So once those are available, we can certainly get that word out and let you know. We haven't quite decided what type of swag we will have that you can hand out to your parents, but we are in the planning stages for that. If you have suggestions of things, we're certainly open to ideas of what you think might be best to give your parents. Feel free to put them in the chat box or to email Stephanie with those ideas. That would be great.
This is Peggy again, and I know one thing we can all easily do is just, put this information out over our various social media channels. I mean, anything that, refrigerator magnets, that's what I was thinking too, Amy. Anything that comes with either a graphic or a video or anything visual, it's easy to put out on Twitter and Instagram, where Facebook's a lot more flexible, but we all, I think, reach a lot of parents that way and make it shareable. So leveraging that capacity.
Well, and I would also, oh, sorry, go ahead, Jennifer.
I was going to say, I would echo what Peggy said. I remember at the beginning of the pandemic, I shared this resource just on my personal Facebook page, and it generated so much interest. So I think that's really effective. The other thing I was going to say is I know when my child was in elementary school, the counselor sent out resources in every weekly newsletter. And so I know that, that would be a really good way to get information out if it's not going out to districts already.
Mm-hmm. Well, and there's a great idea note in the chat bar that if there's a QR code on a refrigerator magnet or on other resources that directs people to the app, that might be a helpful way to spread the word. I'm reminded, I was just blown away when we were doing our community engagement sessions as part of the needs assessment 2 years ago, the number of communities where the Facebook buy-sell trade group is really the go-to for reaching lots of families, particularly young families, and I see lots of nods. If I'm remembering right, I think there's a staff member at Child Care Aware of Kansas who took the time to join all of those groups or to kind of compile a list. And so that might be, if there was a video or some easy social media post, that might be an interesting way to really get the word out broadly. And we've got some agreement in the chat bar from Emily Barnes that there's agreement around refrigerator magnets and QR codes for helpful swag for parents. Any other questions or thoughts or ideas, group? So Stephanie, as people are, what are kind of our next steps here in terms of this project? I know we're about a month after the formal relaunch date.
At this point, we're continuing to schedule presentations with other groups. We have quite a few coming up in December. So that's kind of where we are now, is just working on reaching out with organizations, with other groups to promote this and also to get input from them about other people to connect, other people to meet with. A formal marketing campaign will come in the future as well. I think that's kind of where we are at this point.
Fantastic. So I've got a comment and a question in the chat bar. A comment from Sarah Rivers, making sure doctors' offices and school districts are aware and can link the resource on their website might be another way to share it. And Stephanie, I see you nodding. Plans in place to connect with those groups. I know that we visited about schools. And then Paula Neff has a question. Is there any connection with IRIS, the integrated referral and intake system that several communities, that many communities are adopting to help get families connected to services?
I appreciate that being brought up, actually, because that ties into something else that we're looking at down the road. We would like to be able to make actual referrals. So instead of just giving the parent the information to make that referral on their behalf, but we're kind of at this point having conversations because we want to be really mindful about that. We know that there's communities that are using IRIS. We know that there may be communities out there using Healthify. Aunt Bertha has a referral component. And so kind of at this stage, we're learning more about what's out there, what are people using, and how can we kind of accommodate and work with all of that. So that's something that's on the to-do list in the future. And at this point, we're just having conversations about how we can work together best.
Do we have any other questions or thoughts, group? I think we've got a next slide with some asks for our panel members. Do you want to cover that, Stephanie, or would you like me to?
I'll let you cover that.
Fantastic. So panel members, we've got some really clear asks on this front. One, we acknowledge that the process of putting together a resource directory that covers every service in the state and every community that is up to date is a tall ask and a large order, and it's one that is a team effort. Really, this is something where we know that this is hard work. We know that many communities work hard to develop resource directories to keep them up to date. And something that we heard really loud and clear as we were visiting with families and providers and doing the work of our needs assessment and figuring out where we as a state can go next. We heard that we really need to bolster our work in this area, that we need to have something that's more statewide, where there can be more of a marketing strategy, so that no matter what community you live in, as a parent or a family member, you know where you can go to get resources. And so a really good, easy first step is making sure that programs are included in the resource directory, that people are going in to check to see whether or not their information is there, doing the work to update it, so that before we get to the stage where we're doing that really broad-based marketing campaign, we know that the resources that are in there are reflective of what's available in a community, so that the first time a family member or a community member goes and downloads the app and looks at it, they're like, oh, okay, yes, I can see that this is something that is going to be useful. There's going to be lots of opportunities to share parent outreach information far and wide, and we talked a little bit about that today. So that's going to be a really important opportunity for all of us to be thinking about our spheres of influence, any community organizations we serve on, our personal Facebook groups. I know that I have taken to texting this contact to the folks in my life who are parents of young children or parents of children, because it really is going to be an all hands on deck effort to make sure that we have gotten this information out, so that family members and communities are actually aware of it. And then there's some opportunity to identify, there's some really cool new features. We're super excited about the embedded search bars, the actionable hyperlink images. These are technical things to develop, and we are excited that we have them. So do be thinking about whether that's something where you have a website or a connection to something where we might be able to host it. And of course, please do continue connecting with Stephanie. I know that there is a long list of potential areas of outreach, and there's certainly opportunity to continue doing that, so that this is a message that really has, I know it's a difficult time to get messages to saturate, but this is a message that really has gotten out, so that people know that this is a resource that's available, and they know that they can take these next steps to really make this be a successful statewide effort. Do we have any kind of questions about those next steps, or any thoughts that we'd like to share with the group?
I just want to encourage you to really make sure that your programs are updated and added as needed. And if we can help you in any way, please do that. We've been working with Child Care Aware because they have so much across the state to make sure that theirs are updated. And it is nice that once they're in there, then the Aunt Bertha staff will go through and update every 6 months, so we don't have to. Or if yours are up there, are in there, you can do some of the updates as well. So I do encourage you to really look at it and send us any questions.
Thanks, Pam. All right, folks. That takes us to the last two items on our agenda. This request for future agenda items, I think, is a good chance for us to reflect on our next steps as a panel. Do we have, when we're thinking about these two pieces that we've talked about today, when we think about our previous work, do we have work that we would like to do as a panel, or agenda items that we'd like to request, information that we'd like to learn more about?
This is Peggy. This may be completely, it's just kind of very current where it was going on. I wonder, is there anything that we might want to consider at our next meeting? Maybe January might be better, just about what's happening with the pandemic, with potential vaccination and what that that might mean for us in terms of early childhood? Is there anything that we should be thinking about as a state that would maybe assist or support, whether it's just information sharing or I don't know. I'm just, this is just what's going on today. So it's running in my head. So
That's really timely, Peggy. I know that there is I'm not going to get this name exactly right, but a vaccination advisory council or community that has been pulled together, and that Melissa Rooker is serving on that along with other partners. So I think that that will be really timely, and we'll check in terms of what the best time frame might be for that work. Thank you. I'm smiling because I was recently on a facilitation training that Peggy helped lead, and she encouraged us all to, as we're facilitating, be a little more comfortable with the silence. So I'm going to be comfortable with the silence for another 20 seconds or so.
Amanda, this is Paula. One of the things that we're hearing in our community is the dire need for staff and qualified staff. And, I think it's at the point where we need to take a coordinated effort to figure out what are some strategies and incentives. We know that several programs are having to close because they don't have enough staff. The other side of that is they also have like this, moving target of enrollment. But I think this whole staffing piece is getting to be at a critical point right now.
Thanks, Paula.
Paul, I appreciate that, because that's definitely been, a struggle in trying to make sure that that centers programs have the coverage that they need to be able to provide care. But the second piece of that is also making sure that we have enough children. So what coordinated effort can we have? We keep hearing, okay, well, people can't provide care for their kids, yet providers are closing because they don't have enough kids, and so what kind of awareness can we do, or what kind of coordinated statewide effort can we do to let people know that care really is available? That there really are services out there, there are openings, and what mechanisms do we have, statewide that we can do either with businesses to let them, encourage them to form partnerships with providers, or whatever marketing effort, that we can do or whatnot, just to make sure that there is awareness. But, we also have to have staff in order to serve the kids. So like, which comes first, the chicken or the egg? I don't know, but it's a both and so yeah, so I appreciate that, Paula.
This is Emily Barnes, and I'm gonna jump right on Cornelia's heels here and affirm everything that she just said. I'm also gonna try to put out there getting the family childcare aspect of it too, get some voices in there as well, because we have very similar struggles with people struggling to fill enrollment, but also are struggling to find service. But then also family childcare also has some unique needs and opportunities and successes as well. And so I would say to find a way to engage of doing this work so that we can propel this conversation forward.
Amanda, this is Amy Gottschammer. I recently read a study, and I apologize, I can't remember the name of who actually did it at this point, but the upshot was that they were saying that children were not returning to childcare because families were concerned, about COVID. So perhaps part of the messaging needs to reflect the safety record. Have we really had outbreaks in centers? Have we really had any problems that should be concerning to parents at this point? Are they aware of all the protocols and procedures that we have put in place? What kind of level of safety and, can they feel so that maybe they would be more willing to bring their children back? Right now, according to the study, they're heavily relying on family. So maybe they wouldn't make that choice if they felt comfortable returning to their programs, whether they're center-based or home-based.
Mm-hmm. And then Reva, I had seen you come off mute.
Yeah, I just want to echo, I think this is a really important conversation. I think we're hearing it in every community we work with. I don't know what the answer is, but I think it's a great discussion for this group to have.
Mm-hmm. Fantastic. Well, I want to give a last call if anybody would like to hop in, but I think this gives us some really good pieces to chew on as we consider our next couple months.
Amanda, this is Cassandra Sines. I'm always gonna speak up for kids with special needs. I know some people, especially here in Wichita, are always having difficulty finding childcare for kids with special needs. And we always have to keep that in mind. And because here in Wichita, it's just hard. Some daycare, some childcare centers, they just don't want to deal with it. And so we need to do more for the kids with special needs and their families, because it is hard. And, sometimes the families are single parent families, and they need to work. And if they don't have the family support, there's nothing they can do. And so we need to always keep that in mind.
Thank you, Cassandra.
You're welcome.
Amanda.
Yep, go ahead.
This is Debbie, and I just wanted to point out that David Lindemann put in the chat that there's a COVID-19 vaccination plan put out by KDHE. It was dated October 16th of 2020 with a new review November 4th, 2020. He said it's a 47-page plan, if anyone's interested in that.
Let's make sure that we include that in the follow-up materials for today's meeting. Fantastic. Thank you, Dave. All right, everybody, we've got posted upcoming meetings. So as we talked about at the beginning of our meeting at the Children's Cabinet and Trust Fund meeting on December 4th, Debbie Deere and Peggy Kelly will be presenting the recommendation that we worked through last month around the kindergarten transitions work. So we're very excited about that. The afternoon, there is the Early Childhood Stakeholders Group, which for anybody watching on the YouTube or for any of your knowledge, this is the group that is open to anybody in the state of Kansas. It is our really big virtual opportunity to come together to be able to be engaged to shape this work. And so that will be in the afternoon. And then our next meeting is scheduled for Friday, December 18th at 9 a.m. Everything will be virtual for the foreseeable future. I hope that everybody enjoys a really lovely Friday, a really great weekend. I am very grateful to get to know all of you and work with all of you. And I hope that we all, I know that it has been a tough month and that we've got tough stuff ahead, and I feel really confident that we can do tough things, and I feel really grateful that we get to do tough things together. So I hope that all of you get some good time to rest and relax and recharge in this weekend and next week. And thanks, Maritas, for thanking everybody and wishing us a happy Thanksgiving. That's the end of our meeting today. We are adjourned. Thanks so much to all of our presenters and to all of you. We'll see y'all later on the Zoom.